So in becoming a new surgeon, there's aspects of the transition from fellow to associate surgeon that you don't really consider until you're up facing them. Uh, the one of the difficult aspects is what to do next with your career, whether it's to join a group, start your own group, or partner with somebody to start your own practice. And that decision is a difficult one to make because you have to figure out exactly what was going to work for you. Um, Another pain point, so to speak, uh, being in the position where all of a sudden you have to make financial decisions regarding practice when your experience with with what you've been training to do for the past 10, 15 years is to manage patients. All of a sudden you're acquainted with the business side of things with which you don't have a whole lot of experience. Um, and that's one of the ways that Olympus can help you if you're a new surgeon. Uh, they have experience with dealing with the business side of things that you don't necessarily have, and a lot of people don't have a really an interest in learning is the financial side of things. Additionally, uh, beyond just the financial decision making, it's just the decision making that's inherent in building a new practice, location, competition in the area, what particular surgeries I want to offer, where I'm going to operate. There's a hundred different decisions that you need to make that I became acquainted with when starting this practice in Palm Beach uh, that you just don't consider when you're in residency and in fellowship. Most people, they imagine themselves going to work for a hospital and then that's it. You ride off into the sunset and everything is what you expect it to be. But most everybody, regardless of the area of medicine you practice, you need your own office, which means you need a space, which means you need certain provisions in the office that enabled you to do whatever your specialty is. So there's decisions that need to be made that are beyond your awareness when coming out of residency or fellowship, and Olympus helps you um, better navigate those decisions because that's where their experience lies. They've done all this before. In addition to Olympus, you get access to other surgeons in the group who have been in your position before, who have made mistakes, uh, from whom you can learn, and you don't necessarily have to make your own individual mistakes to learn. So that's the advantage of joining Olympus and progressing with your career.